Imagine discovering that the reason your blood sugar feels impossible to control has very little to do with willpower, discipline, or effort. Not the foods you've eliminated. Not the walks you force yourself to take after dinner. Not even the medications you take faithfully every single day. Instead, the problem may lie in something so basic, so overlooked, that almost no one ever questions it: how hydrated your body actually is, and whether that hydration is reaching your cells at the right times. For many people living with diabetes, especially later in life, this idea sounds almost insulting at first. After all, if something as simple as water mattered this much, surely someone would have mentioned it by now. That skepticism is completely understandable. Most people watching this have spent years, sometimes decades, trying to manage their blood sugar the right way. You've adjusted your diet again and again. You've learned which foods spike your glucose and which ones are considered safer. You've measured carbohydrates down to the gram, memorized glycemic index charts, and followed medication schedules with precision. You may have invested in glucose monitors, attended educational classes, and experimented with supplements that promised dramatic results, but delivered very little. And despite all of that effort, your numbers still feel unpredictable, especially in the morning. What makes this situation so emotionally draining is not just the physical fatigue, though that's certainly part of it. It is the deeper exhaustion that comes from doing everything you retold and still feeling like you losing ground. Many people describe waking up already discouraged, dreading that first glucose reading of the day because it feels like a judgment. When fasting numbers swing wildly from one morning to the next with no clear explanation, it creates confusion and self-blame. You start wondering what you did wrong, even when nothing changed. This pattern shows up again and again, particularly in adults over 60. People who are careful, consistent, and motivated still find their A1C creeping upward. They eliminate foods they enjoy, restrict their lives, and spend significant money trying to gain control. Yet the results don't match the effort. What often goes unnoticed in these situations is that the body itself has changed in subtle but powerful ways with age, especially in how it handles water. Here's the critical insight that reframes everything. A large percentage of older adults are chronically dehydrated, even if they don't feel thirsty. This isn't extreme dehydration that lands someone in the hospital. It's low-grade, persistent dehydration that quietly interferes with normal metabolic function every single day. When this is present, blood sugar control becomes dramatically harder, no matter how perfect everything else looks on paper. Most discussions about diabetes focus almost entirely on food. What you eat, when you eat, how much you eat. Very little attention is given to how and when you drink. Hydration is usually treated as an afterthought, something assumed to be adequate as long as someone isn't obviously thirsty. But thirst is a poor indicator, especially later in life, and by the time it appears, dehydration is already well established. What's important to understand is that hydration is not just about fluid in your stomach. It's about water inside your cells. That internal environment determines whether insulin can do its job properly. When cells are even mildly dehydrated, their membranes become less flexible and less responsive. Insulin signaling weakens, glucose struggles to enter the cell, and sugar remains trapped in the bloodstream. From the outside, it looks like worsening diabetes. On the inside, it's a mechanical problem, not a failure of effort. This perspective changes the conversation entirely. It shifts the focus away from blame and frustration and toward optimization. The goal isn't to abandon medications or ignore medical advice. The goal is to create the conditions inside the body that allow existing treatments to finally work as intended. Once that environment is improved, many people are shocked by how quickly their numbers begin to stabilize. Before diving into exactly how hydration affects the body at a cellular level, and why aging makes this problem far more common than most realize, it's important to recognize that this is not about quick fixes or miracles. It's about addressing a foundational need that has been quietly neglected. When that foundation is restored, everything built on top of it, diet, medication, insulin response, has a chance to function properly again. To understand why hydration becomes such a powerful lever for blood sugar control later in life, it helps to look at what actually changes inside the body with age. These changes are gradual, invisible, and rarely explained in a doctor's office, yet they directly influence how glucose moves through the bloodstream and into cells. Many people assume that if they drink some fluids each day, hydration is handled. In reality, aging alters how water is absorbed, distributed, and retained, creating a quiet metabolic disadvantage that builds year after year. The first major change happens at the cellular level. Every cell in your body relies on specialized protein channels to pull water inside. These channels, known as aquaporins, regulate how efficiently water moves from the bloodstream into the cell. As we age, these channels become less responsive. That means, even when you drink water, your cells don't absorb it as readily as they once did. The water may pass through your system, but your tissues remain underhydrated. This is one reason older adults can drink regularly and still exist in a state of cellular dehydration. The second change involves kidney function. By the time most people reach their late 60s or early 70s, kidney filtering capacity has naturally declined by roughly 30%. This affects blood sugar in two important ways. First, the kidneys are less efficient at removing excess glucose from the bloodstream, allowing higher levels to linger longer. Second, they become less capable of concentrating urine. As a result, more water is lost during urination, even when the body needs to conserve it. This creates a slow but steady drain on hydration status that many people never notice. The third change is perhaps the most misleading. The thirst mechanism itself becomes impaired. Studies show that in older adults, the sensation of thirst can be delayed by up to an hour or more after the body actually needs water. In practical terms, this means you can be dehydrated without feeling thirsty at all. Many people interpret the absence of thirst as a sign they are well hydrated, when in fact the opposite is true. By the time thirst finally appears, dehydration has already reached a meaningful level. The fourth factor is medication. Many individuals managing diabetes also take medications for blood pressure, heart health, or swelling. A significant number of these drugs have diuretic effects, meaning they increase water loss through urine. While these medications are often necessary, they quietly intensify dehydration if fluid intake isn't adjusted accordingly. Over time, this creates a chronic imbalance where the body is constantly losing more water than it replaces. When these four factors combine, the result is a cellular environment that is fundamentally hostile to insulin. Even mild dehydration, as little as 2 to 3%, changes the physical structure of cell membranes. They become more rigid, less flexible, and less responsive. Insulin receptors embedded in those membranes don't function properly under these conditions. It's not that insulin is absent. It's that the door it needs to open has become stiff and unyielding. This is why blood sugar can rise even when diet and medication remain unchanged. Glucose stays trapped in the bloodstream because it cannot efficiently enter dehydrated cells. The pancreas may release insulin, or insulin may be injected, but the signal doesn't translate into action. From the outside, it appears to worsen insulin resistance. Internally, it's a hydration problem disrupting basic cellular mechanics. This explains a common and deeply frustrating pattern: stable diabetes that suddenly becomes unpredictable. Morning readings jump around with no dietary cause. One day looks reasonable, the next looks alarming, despite identical routines. When hydration is examined closely, the missing link often reveals itself. Water intake is low, inconsistent, or poorly timed, and thirst never sounded the alarm. Understanding this physiology is a turning point. It reframes blood sugar instability as a solvable mechanical issue rather than a personal failure. Once hydration is addressed strategically, the body's systems regain flexibility. Cells become more receptive, circulation improves, and insulin begins to work the way it was always meant to. By the time most people reach their 60s, their daily hydration habits are built on assumptions that no longer hold true. These habits often feel reasonable, even healthy, yet they quietly work against blood sugar control. The problem isn't that people aren't trying. It's that the rules around hydration change with age, and almost no one explains that shift. As a result, the majority of adults managing diabetes are making the same few mistakes without realizing the impact those mistakes have on their glucose readings. The first and most common mistake is counting beverages like coffee, tea, or flavored drinks as water. Many people begin their day with coffee, have tea in the afternoon, and maybe a glass of water with meals, assuming it all balances out. What's rarely understood is that caffeine acts as a mild diuretic. When you drink coffee or tea, your kidneys increase urine output, pulling water from your body's existing reserves. In practical terms, much of that beverage does not hydrate you. It actually leaves you slightly more depleted than before. Over the course of a day, this creates a net loss of water, even though fluid intake appears adequate on the surface. Juices and diet sodas create their own problems. Even unsweetened juices raise blood sugar enough to trigger the kidneys to flush both glucose and water from the bloodstream. Artificially sweetened drinks can worsen insulin resistance and confuse metabolic signaling. These beverages may feel refreshing, but they don't contribute to true cellular hydration. Only plain water reliably moves into cells without creating unintended metabolic side effects. The second major mistake is drinking very cold water, especially first thing in the morning. Cold water feels crisp and energizing, which is why many people prefer it. Physiologically, however, it triggers a stress response. When ice-cold water hits an empty stomach, blood vessels constrict to preserve core temperature. This reduces circulation at the exact moment when the body is transitioning from sleep to activity. Reduced circulation means glucose and insulin move more slowly through the bloodstream, delaying their ability to reach cells efficiently. Cold exposure inside the digestive tract also stimulates cortisol release. Cortisol is a stress hormone that tells the liver to release stored glucose. This can create a blood sugar spike before breakfast, often contributing to the frustrating dawn phenomenon many people experience. Warm or room temperature water, by contrast, keeps blood vessels relaxed, supports circulation, and allows the morning metabolic transition to happen smoothly. The third mistake is waiting until thirst appears and then drinking large amounts all at once. Because thirst signaling weakens with age, by the time you feel thirsty, dehydration is already significant. The instinctive response is to drink a large glass or two, assuming the problem is solved. Unfortunately, the digestive system can only absorb a limited amount of water at a time. Excess fluid simply passes through to the bladder and is excreted without ever reaching the cells that need it most. This pattern creates the illusion of hydration without the benefit. People feel like they're drinking plenty of water, yet their tissues remain dry. It's similar to pouring a bucket of water onto dry soil all at once. The surface floods, but very little penetrates down to the roots. True hydration requires smaller, more frequent amounts that the body can actually use. These three mistakes reinforce one another. Coffee replaces water. Cold water adds metabolic stress. Infrequent, large intakes overwhelm absorption. Together, they create a daily cycle where dehydration persists despite good intentions. Blood becomes more concentrated, glucose readings drift upward, and insulin appears less effective. Recognizing these errors is a crucial step forward. It shifts hydration from a passive habit to an active strategy. Once these patterns are corrected, the body responds surprisingly quickly. Circulation improves, stress signaling calms, and glucose readings become more stable. With these obstacles out of the way, it becomes possible to introduce a structured hydration approach that works with the body's physiology instead of against it. Once the common hydration mistakes are removed, the next step is replacing them with a structure the body can actually respond to. Hydration works best when it follows predictable patterns. The body is highly adaptive, but only when it knows what to expect. Random water intake leads to random results. Strategic intake, on the other hand, allows the kidneys, blood vessels, hormones, and cells to coordinate their responses. This is where a simple, repeatable framework makes all the difference. The first element is the water itself. Quality matters, not because water needs to be expensive or exotic, but because cells require more than pure H2O. For water to move efficiently into cells, it must carry electrolytes, small amounts of minerals that create the electrical gradients cells depend on. Without these minerals, water tends to pass through the body rather than being retained where it's needed. Filtered water works well for most people, especially when trace minerals are added back in small, consistent amounts. This creates a form of hydration that actually reaches the cellular level, instead of merely filling the stomach. Timing is the second and most critical element. The first hydration window occurs immediately upon waking. After 7 to 8 hours without fluid, blood naturally becomes thicker and more concentrated. Drinking water right away gently restores blood volume, improves circulation, and helps insulin move more efficiently. This early hydration also signals the nervous system to wake the body gradually, reducing the cortisol surge that often pushes morning blood sugar higher. Starting the day this way sets a calmer metabolic tone that carries forward for hours. The next key window is before meals. Drinking a moderate amount of water about 30 minutes before eating prepares the digestive system without interfering with digestion. This timing helps activate enzymes, optimize stomach acidity, and slow the movement of food from the stomach into the intestines. When carbohydrates enter the bloodstream more gradually, glucose rises at a pace insulin can manage. The result is smaller post-meal spikes and smoother curves instead of sharp peaks and crashes. Between meals, hydration serves a different purpose. During these periods, blood sugar often behaves unpredictably. Many people assume glucose should remain steady if they aren't eating, but dehydration causes blood to become more concentrated, which raises readings even without additional glucose. Small scheduled sips during mid-morning and mid-afternoon help maintain consistent blood volume. This stabilizes readings and prevents the unexplained rises that lead to frustration and confusion. The evening hydration window is often misunderstood. Drinking large amounts right before bed can disrupt sleep, but hydrating earlier in the evening has the opposite effect. When water is consumed 2 to 3 hours before sleep, the body has time to distribute it properly and eliminate excess. This prevents overnight blood thickening and supports better circulation in the morning. Waking up adequately hydrated reduces the likelihood of elevated fasting glucose and morning sluggishness. The final component is regulation, which refers to how the body adapts over time. When someone has been dehydrated for months or years, the body enters a conservation mode. The kidneys concentrate urine, thirst signals are suppressed, and cells resist fluid intake. When hydration suddenly improves, frequent urination is a normal and temporary response. This phase discourages many people, but it's a sign of recalibration, not failure. Within 1 to 2 weeks of consistent timing, the body begins to trust that water is reliably available. Kidney function adjusts, bladder capacity improves, and cells accept fluid more readily. Bathroom urgency decreases while true hydration improves. Even more importantly, metabolic rhythms stabilize. Blood sugar readings become less erratic, energy levels improve, and mental clarity often increases. This structured approach turns hydration into a predictable signal rather than a sporadic event. Over time, the body begins anticipating these hydration moments, aligning hormone release, circulation, and glucose handling accordingly. What once felt like a constant uphill battle begins to feel more manageable, not because of a new medication or stricter diet, but because the internal environment has finally been brought back into balance. When hydration is implemented strategically and consistently, the changes that follow tend to unfold in clear stages. Understanding what to expect prevents unnecessary discouragement and helps people stay the course long enough to see meaningful results. The first week is often the most challenging, not because anything is going wrong, but because the body is adjusting after a long period of operating in a dehydrated state. Increased bathroom trips are common as the kidneys begin releasing stored waste and excess glucose. This phase is temporary, but it is the point where many people give up if they are not prepared for it. During this initial week, blood sugar improvements are usually modest. Some people see a small drop of 5 to 10 points in fasting or average readings, while others notice more consistency rather than lower numbers. Energy levels may feel slightly better or unchanged. The most important thing happening beneath the surface is recalibration. The body is learning that water is no longer scarce, and it hasn't yet adjusted its conservation mechanisms. Patience during this phase is essential. By the second week, things begin to shift. Bathroom frequency typically decreases as the kidneys adjust, and urine concentration normalizes. Blood sugar readings often show less variability throughout the day. Instead of sharp, unexplained swings, numbers begin clustering within a narrower range. This consistency alone is a major psychological relief for many people because it restores a sense of predictability and control. The third week is when many experience a noticeable breakthrough. Morning fasting glucose often drops by 15 to 25 points compared to baseline. Post-meal spikes become more manageable, rising and falling more smoothly. People frequently report improved mental clarity, reduced afternoon fatigue, and better overall stamina. These changes reflect improved circulation and cellular hydration, particularly in the brain and muscles, which are highly sensitive to fluid balance. By the fourth week and beyond, hydration-driven improvements compound. Over several months, many individuals see measurable reductions in A1C, often in the range of half a point or more, under medical supervision. In some cases, medication dosages can be reassessed because insulin sensitivity improves and glucose control stabilizes. These decisions must always be made with a healthcare provider, but the underlying improvement comes from restoring a functional cellular environment. It's important to emphasize that hydration is not a cure for diabetes. It does not replace medications, dietary management, or medical oversight. Instead, it enhances all of them. When cells are properly hydrated, insulin signaling improves, circulation becomes more efficient, and metabolic stress decreases. This allows existing treatments to work closer to their intended effect, rather than constantly fighting uphill against dehydration-induced resistance. There are also important safety considerations. Individuals with conditions involving fluid retention, such as congestive heart failure, must approach increased hydration cautiously and only with medical guidance. Those with advanced kidney disease require individualized plans to avoid fluid overload. People taking diuretics may find that blood pressure changes as hydration improves, which can require medication adjustments. Awareness and communication with healthcare providers are essential. Signs of excessive hydration are uncommon but should be recognized. Persistently clear urine throughout the day, frequent urination without thirst, headaches, or nausea may indicate the need to slightly reduce intake. Hydration should feel supportive, not uncomfortable. Perhaps the most powerful aspect of this approach is psychological. Many people realize they spent years micromanaging complex variables while overlooking the most fundamental requirement of their biology. Restoring hydration often brings a sense of relief and empowerment, not because it's miraculous, but because it's logical. When the body is given what it needs consistently, it responds. Long-term success comes from consistency rather than perfection. Small, well-timed actions, repeated daily, reshape metabolic patterns over time. For many, this becomes the missing foundation that finally allows blood sugar control to feel achievable again, not through struggle, but through alignment with how the body actually works.